I think the autoimmune hypothesis of narcolepsy has been around for a few decades now. Especially since 10 years ago, there was this peak in the incidence of narcolepsy after the Mexican flu pandemic, swine flu pandemic. There has been really a surge of interest in the autoimmune hypothesis. And I think much of the research was focusing on finding an autoimmune response in narcolepsy. And it has proven quite difficult to really show that. And for now there are some groups that have showed some reactivity to the swine flu or to hypocretin. Maybe it's good to tell you that narcolepsy is caused by the destruction of hypocretin-producing neurons. So what you would expect is that there's an autoimmune response targeting hypocretin. So all these tests trying to find that. So far, it's not a huge success, unfortunately, because we see some reactivity, but also also in healthy controls. So then we don't know whether it's actually causing the disease. So the challenge is, okay, how do we overcome this problem that we are not able to pinpoint what is happening in the process leading to the destruction of hypocretin-producing neurons? Well, what we are trying to do, and one of the things I presented as well, is that we are going to try to use novel immunological techniques to dive deeper into the immune system and to really look at very small immune cell populations to see whether they could play a role. And another way to move forward is to use other techniques and also to think about, is hypocretin indeed the target of the autoimmune response? Keeping our mind open is, I think, the best step, using novel techniques that are being developed very quickly now, not only in the field of narcolepsy, but I think in the field of immunology worldwide.